if you think of our nervous system, the central nervous system, that includes the brain, and then the gut has its own nervous system, and that's the enteric nervous system. And because there's almost like a little brain in the gut, that little brain has a really close relationship with the big brain. And they're always talking to each other back and forth.
Yeah.
So what happens in the gut affects our brain, and what happens in the brain affects our gut. And that's probably the easiest way to think of it. And so when something is happening in the brain, for example, they change schools, or they're getting bullied, or they're struggling in their classes, for a large percentage of kids, that's going to have effects in their gut. And sometimes those effects are not just temporary, they become cyclical and self-reinforcing. And that's when you have what's called a disorder of gut-brain interaction.
And many kids, I feel like they get trapped in this sort of cyclical pain cycle, right? Their belly hurts. Their brain is telling them it hurts more. It makes the belly hurt. It makes the brain tell them more. And it's like, do you feel like there's that amplification response to something that is pain, but it's because it's the psychology is being involved as well?
With these disorders like functional abdominal pain or IBS, not only does the brain send that stress and anxiety into the gut, and then the gut reacts with more symptoms, but then all the sensations from the gut get sent back to the brain, but the brain doesn't just accept those sensations, it actually amplifies and distorts them. So what might feel like a little gas gets amplified and distorted to feel like crippling pain and discomfort, and they can't even want to move. Maybe it makes them nauseous.
Hey everyone, welcome back to the PedsDocTalk podcast. You are watching this on my YouTube channel. Remember to subscribe to the channel so that you can stay up to date on all of the amazing podcasts we bring here, as well as all the videos on education I provide for you. And I am so excited to welcome today's guest. His name is Dr. Ali Navidi. He's a licensed clinical psychologist and one of the founders of GI Psychology, a national telehealth practice specializing in helping patients with GI disorders and chronic pain. And Dr. Navidi oversees training and outreach at the practice. And he's joining me to talk about abdominal pain, gut health, how it's connected to the brain, and why this is such an important aspect to learn about. So thank you so much for joining me today, Dr. Navidi.
My pleasure, Dr. Mona. Thank you for having me here. I'm excited to talk more about all those little kiddos with stomach aches.
Well, I like to give origin stories for my listeners on how I find my guests, because sometimes I follow them on social. Sometimes people, message me, but I have a guest form, and my guest form I go through every time I'm looking to schedule guests. And your team had put in the request to be on the show. And I was like, oh, wow, this is amazing. A GI psychologist. And the reason why I'm so excited to have you on is that I don't think a lot of people realize how connected a lot of our abdominal complaints are to our mind, especially in children. And we're going to dive into that. And I think when people hear this, they sometimes think, oh yeah, that means all my abdominal pain is in my head. No, it means that there is a heavy connection between how our tummies can feel and how our brain can exacerbate that. It doesn't mean that the pain isn't real. So I'm so excited we're here to have a practice that's very rare. I want to hear more about that. What made you decide to start, GI psychology, and why do you think it's such an important thing that we have as a resource in this community?
Yeah, so I'm a psychologist, and I've had a private practice in the DC metro area for about 14 or so years. And I slowly found myself becoming more and more specialized. And I think mainly because there just wasn't anyone else who was trained to do that kind of work. So slowly over time, I just started seeing more and more GI patients.
Yeah.
Specifically, I think just the combination of skills just wasn't available, meaning psychologists who could see kids and adolescents, who is trained to do GI work, who is also trained in the modalities of treatment needed, which are very specific protocols of CBT, cognitive behavioral therapy, and specific protocols of clinical hypnosis. And so slowly over time, all the gastroenterologists who are working with kids, just I became their go-to person because they didn't have anyone else.
Mm, that's
And
amazing. And yeah.
yeah, go ahead. Sorry.
And so then you decided to start this platform based on just what you experienced.
Yeah, yeah, and the idea of GI psychology is to make available this kind of treatment and to try to make available in all 50 states. Because up until now, the only other option was very specialized university medical centers that often had tremendous wait lists. You had to go in person or you had to be in the state to get there. And we wanted to change that. We wanted to make it available for patients all over the United States.
I love this. I love having this podcast to be able to platform resources like the ones that you're creating. I think it's such an important thing. Like you said, knowing that you're seeing a lot of people come in with GI complaints, it probably sparked this light bulb of, okay, if I'm a
Yeah,
psychologist and I'm seeing all these people come in, there must be something here that we need help to provide help with. And were you also seeing a lot of children? And if so, how young were these children that were coming into your offices?
I was typically seeing them as young as 8 years old, but
Mhm.
at our practice, we see them 6 years old and sometimes younger. We have some specialists who specialize in the youngest kids. Although that work tends to be more about like encapresis and you're
Yeah.
working with the parents a lot. But as they get to at least 6 years old, then you can start working directly with the kid. They might be having functional abdominal pain or nausea or some kind of vomiting issue, and you can work directly with them at 6.
Well, I'm excited because we are gonna dive into that term later, functional abdominal pain, which is so
Yeah.
important as a pediatrician, and I know for yourself as a GI psychologist. But before that, I wanna take a step back a little bit, and if you could explain to our listeners the gut-brain axis in simple terms and why it
Yeah.
matters for children's health, behavior, and especially as we talk about stomach complaints as we will with pain, nausea, and anything else kids may complain with their bellies.
So, kind of a simple way to look at it is if you think of our nervous system, the central nervous system, that includes the brain, and then the gut has its own nervous system, and that's the enteric nervous system. And because there's almost like a little brain in the gut, that little brain has a really close relationship with the big brain and they're always talking to each other back and forth.
Yeah.
So what happens in the gut affects our brain, and what happens in the brain affects our gut. And that's probably the easiest way to think of it. And so when something is happening in the brain, for example, they change schools or they're getting bullied or they're struggling in their classes, for a large percentage of kids, that's going to have effects in their gut.
Yeah.
And sometimes those effects are not just temporary, they become cyclical and self reinforcing. And that's when you have what's called a disorder of gut brain interaction, which is this broad class of disorders.
I love the way you already described that, the little brain talking to the big brain. That's perfect, especially not only for a parent, but also a child. Like, I love that explanation because obviously most of my listeners are parents, but now they can talk to their kids about how, hey, you have this big brain that does a lot of thinking, but your tummy
Right.
is also doing a lot of thinking and learning too every day. I love that. And I think this is a good segue to talk about that term, functional abdominal pain.
Yeah.
And I would love if you could define that for, again, a parent who may not know what that term is and how it relates to that gut brain connection that we just talked about.
Yeah. So you can think of an example of maybe a typical patient, like a 10-year-old, and suddenly they're complaining about their stomach is hurting, and it's happening more often in the morning around, kind of when they
Mhm.
wake up. And no, of course, they go to their pediatrician, and their pediatrician goes through and rules out all these these like danger signs. And once they've ruled those out, depending on the pediatrician, sometimes they can, yep, there you go. Sometimes they can even say with a good amount of confidence, hey, this looks like functional
Yeah.
abdominal pain. And what that means is that there isn't anything structurally wrong. There's no inflammation. Like there's a lot of things that it's not. And what it is the way that the system is functioning is a problem. And even more precisely nowadays, because functional was the old term and now it's disorder of gut brain interaction. And
Mm,
what that means is the way we could go back to our old metaphor.
yeah.
The way the big brain is talking to the little brain is causing some trouble.
Mm,
And that trouble comes out as pain. And that pain, to all the parents out there, is 100% real. It's not just in their head. It's
yeah.
no different than pain that you'd feel if there was, something really wrong in there, like physically wrong.
I'm getting a little emotional, and I don't know if it's because I see this so often or because I think parents sometimes can get frustrated when their kid keeps complaining of
Yeah.
that belly pain, right? Like they're like, nothing's wrong with you. And they see it, right? And then maybe their pediatrician, who's not like myself and many other pediatricians, says that everything's normal, like everything looks great, like, and doesn't bring
Yeah.
up the fact that the mind is involved in this. And I've had many times in my office, and I'm sure you have as well, where I'm talking to the family and it's that 10-year-old or 11-year-old, and I tell them, I'm like, I need you to understand that I believe you. I know
Yeah.
something is not feeling good in your tummy, or sorry,
Yeah.
stomach, or whatever the age of the child. I sometimes use tummy. And this, the relief they feel to know that we don't believe as a medical professional that it's fake is so
Right.
important. It's like anything, and, you think we're talking about belly pain, but we think about people who are struggling with any sort of pain in their body that we cannot put a value on, or we're not in that
Yeah.
body, but just to say, "I believe you," and that
Yeah.
I know that this is real and that it's not in your head, I think is such a valuable thing in itself, and I'm sure you feel the same way.
Yeah. And especially when you can give the patient and the parents an understanding of how and why this is happening.
Yeah.
Because otherwise, I understand, being a parent myself, I understand how easy it is for a parent to see it that way, uh,
Yeah.
because it does look suspicious. You're kind of like,
Yeah.
okay, I know my kid has been having trouble in school, and it seems like their stomach is always hurting right before
Yeah.
school. So maybe they're doing this to try to get out of school and stay home. Like, it's understandable why they think that, right? Um, however, um, you can see that in case after case, this pain is very real. It's really affecting, and people just don't understand the power of that mind gut connection.
And what we do as clinicians and our job, and you really talked about that beautifully, is when I have a patient coming in, I always rule out the organic issues. What I mean by organic, and for anyone who's not familiar, is I go through my Rolodex of if this is something like reflux, is it constipation? Is it something like an intolerance to a food? Is it a food allergy? Like anything that can be treated either with a prescription or a specialist or something like that is what I'm looking at first when I think about the rule outs. Maybe we have to do some celiac panel or, looking for at celiac disorder. But then I always talk to the family about that differential, which is I'm going to do all the testing, but I don't want us to rule out that this could be something called functional abdominal pain. But you said that the better term now was disorder of gut brain connect interaction. I like that.
Yeah, disorder of gut brain. So DGBI.
I love
That's
that. I'm gonna actually see. This is why I love having people on my show because I didn't know that there was a new term. I love that,
yeah,
and so it's so important that we do that. It's so important for all of our listeners that if you're going through this with your child, that we understand the frustration. We understand when there's something that seems invisible, how it can feel like, oh my God, they're trying to get out of something, but it's not them trying to avoid something. It's them feeling some feelings and just don't know how to respond to that. So I guess my question for you, having, being a GI psychologist is why do some kids have these real GI symptoms
mm,
even when all the tests come back normal, or why is it so much
yeah,
stronger that they're that when they're feeling nervous about school or changing school, why is it that that's manifesting more in the belly than, let's say, an adult would feel?
yeah. It's interesting, and I think part of that, to me at least, is kind of like a question mark,
Yeah.
right? Maybe it's genetic, maybe it's some small biological developmental issues. Um, However, I think a large part of it comes from experience.
Hmm.
And what I mean is there's this concept that I like to call PTSD of the gut.
Mhm.
And what that means, as I describe it, is there are people out there, there are kids that have had some sort of gut trauma,
Yeah.
whether that's a bacterial infection or maybe they're just always been prone to GI problems. But for those people, their brain has learned to kind of view the sensations coming from the gut with a bit of suspicion
Mm.
and fear. And it's not something that's conscious, it's something that happens unconsciously. And one of the things that happens when the brain views an area kind of like, oh, this is dangerous, is it that manifests through pain.
Mhm.
Pain is the brain's way of saying about something, this is dangerous, I'm worried about it,
Yeah.
right? Um, and I know for some people that's hard to believe who've never kind of experienced it, but it's really profound. These are not this kind of pain is can be just as damaging, just as hard to deal with as any type of pain they'll experience. Many of the patients I've worked with have been to the ER multiple times because the pain has been so severe. Um, but it's kind of like once their brain has been conditioned to view that those GI symptoms with danger, um, it's always kind of keeping an eye on it, and and that makes it really easy when they're stressed or difficult things are going on in their life. That stress and anxiety gets transmitted right down to the little brain in the gut.
Well, I think a lot about IBS, right?
Yeah,
Irritable bowel syndrome. My husband and I both had IBS in medical school and residency.
yeah,
And
there you
and when
go.
I say that, we probably had some degree of it, but it got worse. What I mean by that is our stress in residency, and we didn't know each other in residency. Our
Yeah,
stress caused diarrhea, constipation. It caused us to feel that butterfly in the stomach feeling. And I think we all can relate to that terminology, like you feel that pit in your stomach. Like just
yeah,
say something happens emotionally and all of a sudden you feel that weight or you feel nauseous all of a sudden. Or maybe you got some really bad news and you feel like you want to throw up, right? Like that is a powerful feeling, and I for one have been there, right? When my emotional state has caused that little brain to be like, "Ooh, yeah, you know what? We don't like this right now. No, I don't want to keep this food down."
yeah.
And, I think it's a real I mean, obviously it's a real thing that I think any adult can kind of relate to as well.
Yeah, and you can see in terms of that simple little history,
Mhm.
um, your history before medical school kind of primed you.
Yeah.
Maybe you had a few little here and there problems, but nothing too big deal. And then you went through this kind of meat grinder of
Of
a
stress, yes.
of an institution,
That's
right?
a way
Like
to put it. I like it. Yeah,
they
yeah,
just kind of crunch you.
yeah. Yeah.
And through all that stress, anxiety, constantly feeling uncertain and
Yeah.
unsure, all those emotions and feelings get transmitted into the gut. And there's one other thing I want parents to really understand who've got kids that have these types of problems is this concept called visceral hypersensitivity.
Mhm.
And that's a really important concept because what it is with these disorders like functional abdominal pain or IBS, um, not only does the brain send that stress and anxiety into the gut and then the gut reacts with more symptoms, but then all the sensations from the gut get sent back to the brain. But the brain doesn't just accept those sensations, it actually amplifies and
Yes.
distorts them. So, what might feel like a little gas gets amplified and distorted to feel like crippling pain and discomfort, and they can't even want to move. Maybe it makes them nauseous, right? Everything gets it's like someone as a joke takes your iPhone and turns the volume all the way up when you're listening to music, right?
I love that example. Your analogies and descriptions are like spot on because I'm listening and I'm like, yes. And even if I haven't been through that, when I speak to that patient in front of me and they're feeling
Yeah,
that cyclical feeling, right? And I know we're talking again about pain in the abdomen, but this is pain in any other part of your body, like, and
yeah,
I, and
yeah,
I talk about it with my son, like when he hurts his knee, right, and it's
right,
hurting so bad at that moment, and I say,
right,
I know it hurts. I don't dismiss him. I don't say, it's sweetie,
right.
it doesn't hurt. It's not a big deal. I say, I know it hurts, but can I tell you something? It's gonna feel better. it's going to feel better. And I'm almost trying to meet
Right.
his psychology so that he's not like going into the spiral of this is going to be painful forever. And in
Oh,
many kids, and I think we're going to get to this, but in many kids, I feel like they get trapped in this sort of cyclical pain cycle, right? Their
yeah.
belly hurts. Their brain is telling them it hurts more. It makes the belly hurt. It makes the brain tell them
Yeah.
more. And it's like, do you feel like there's that amplification response to something that is pain, but it's because it's the psychology is being involved as well?
That's 100%. You
Yeah.
brought up so many things I want to respond to just in
I
saying
love
that.
it.
Um, just that example of every parent knows this, right? You're watching, let's say, your little kid and they're riding their little bike and they're all unsteady and then they fall. And right after they fall, they don't cry right away.
Mhm.
They look at
Yes.
you,
Yes.
and how you respond in that moment determines how they're going to respond.
Do you watch my videos? I literally talk about this all the time. I
Oh,
know you
really?
I that's so funny. Like one of my biggest things on social is I do response videos and I say, "Parents, you got to control your reaction." Like you
Yes.
don't need the big reaction. I'm talking about for everything, and especially injuries, but also illnesses and health. I mean, if we go like this every time they get ill, like with a fever and go into anxiety mode,
You're
they're
teaching
gonna
them.
go, "Yes.
Yes.
Yes." I love that.
Preach it,
Preach it. I
Dr.
love it.
Mona.
I love this
Yes.
connection. This gut, little brain, big brain, or two big brains, whatever we wanna
Oh,
talk it.
yeah.
We're doing it right now. Yeah.
Yeah, because they're using you as
Yes.
their kind of like way to figure out how much danger they're in.
Mhm.
And if they feel like they're in danger when they fall, their brain is going to be like, okay, ramp up the pain.
Yeah.
And the pain goes up and they cry and then you run over and versus the parent that's like, oh wow, that probably hurts, but I bet you want to keep on having fun, don't you? And like redirects them and or whatever needs to happen at that
Yeah.
point, right? And it's interesting when you look at the research. They've done this research, let's say with I think it was with patients with functional abdominal pain. The parenting style matters in terms of outcomes, right? So what do you see? You see those parents who are overly empathetic, actually their kids get worse.
Yes.
They have worse outcomes versus the parents that are a little more matter of fact, a little more kind of like, okay, I know it's tough right now, but we gotta go to school today. Like just matter of fact, not making too big of a deal of it. Their kids do better. And if they take even just one thing from this show, I'd like them to take that is once you've gotten the problem checked out and you know it's none of these other dangerous things, how you react as a parent and just watch Dr. Mona's
I
videos
love that.
and
It's
like
so fun. When you said that, I was like, "Oh my gosh, thank you, psychologist, for telling me this." I love
oh, that's
it.
great.
No, it's so true though. And I mean, again, we are talking about an area that I think is so important. And another story I didn't tell you or my listeners is that in medical school, or sorry, I apologize, in residency, I was seeing a lot of young children come in for functional abdominal pain. And I actually did a study on
Oh,
functional abdominal pain. And it was I forget the name of the project, but my project was that I saw so many kids coming in with functional abdominal pain that I wanted to go downstream and teach kids coping skills in the early ages so that they can
awesome.
have coping skills that can potentially reduce the risk of functional abdominal pain. Because my
Yeah.
concern is that did these children not get healthy coping skills with anxiety, with new things that they're learning? And
Yeah.
that was my project. So we created a
Very
project
cool.
of like going into schools, going into, I'm talking like 5-year-olds, 6-year-olds, and
Yeah.
teaching them about their bodies, but also just teaching them about their feelings. And I'm such a big
Mhm.
feeling discussion person, not only because it's great for parenting and for teaching for the child, but for physical ailments, right? Like
Yes.
I
Yes.
was sick in an ICU, and if it wasn't for my mindset, and I believe this strongly, I
Yeah.
probably would have been there longer. But I told myself, we're going to get through this. I'm going to heal. I need to have surround myself with people that are realists, but also that are going to be optimistic about my health. And it was
Hmm.
really important. And, I think this is such an important conversation because when I was in residency and I saw those patients come in and I saw a very simple strategy that they would be admitted to the hospital because they needed the workup. right? Meaning
Right.
they were having this cyclical vomiting or they were having
Yeah.
this
Yeah.
abdominal pain and everything was coming back normal. And then
Yeah.
the child life specialist would go and have them smell lavender essential oils and the
Mm,
kid would just relax. Every time they had the abdominal pain, they told us that it felt better. And we all we all knew that there was some degree of psychosomatic component there that yes, they were feeling calm. And then I would look at the parent that would ask for we need another CT. We need
yeah.
another image. We need this. We need this. And I'd have to pull the family aside and say, "We are doing everything. We believe you. We believe the child, but I want you to look at how this child's responding when they're feeling calm, when they're
Right.
feeling relaxed, how that's impacting their abdominal
Because we're
pain."
conditioned, I think,
Yeah.
as Americans, we're conditioned to find the thing.
Yes.
The thing. What is the thing? The thing is like something's wrong, something's
Mhm.
broken, something's needs medicine or a surgery or something. And we're not really taught about the subtleties
Yeah.
of the nervous system and how it relates to the gut and how it relates to the body as a whole. It's no surprise that a lot of these kids also have a lot of headaches.
Yeah.
They
Yes.
also have a lot of musculoskeletal like
Mhm.
pain, but because their brains are conditioned to find threat in the body. And remember, the brain translates threat into pain.
Yeah.
You can remember that. That's another important one out there. The brain translates threat into pain.
I'm writing this down. I know. I'm writing it down because this is going to be this is going to be the star statement of the episode because it is true, and I
Yeah.
don't think people realize is that when we discuss pain management in so many different ways and in children, most children don't have the back pain, the musculoskeletal pain, they have abdominal pain. It is
Yes.
where they get it, and it's because of this developing gut brain connection that I believe that that's why it's so strong, is that their gut is so in tune and they're like, "Whoa, I'm feeling it
I
all in my
love that
belly."
you started that program to
Yes.
start teaching them early because, I see it when they're 13 or 16 or 45, and they've had all this time to reinforce these neurological pathways of pain and fear.
Yeah.
And if we can get ahead of that early, I think you're going to help a lot of people.
And, obviously, to be transparent, that was a residency project. So it's
Yeah,
not
yeah.
obviously something I'm doing now, but it is something that's such a big philosophy in my education, which is why I was fangirling that you guys wanted to come on my show. And I was like, who is this? I need to meet him. I need to talk to him because this is really important. And it is something that I said, like, I know we can help so many people. And obviously as adults as well because this all starts in childhood.
Yes.
So I want to be able to talk about that. And I know maybe you've already answered this question, but like, how do conditions like IBS, cyclic vomiting syndrome, or avoidant eating reflect this gut brain link in action? Maybe if
Yeah,
there's
I'll give
anything
you
else you want
another
to add. Yeah.
example of a patient of mine. I think she had, a nice family dinner and then, eventually went to bed. And then in the middle of the night, she woke up just vomiting.
Mm,
Think about how disorienting and scary it is to like go from dreaming and
yeah.
probably some nasty dreams because you're in pain and like your stuff, and then just throwing up and you're
Yeah.
confused. And so she went through food poisoning, right? And she, of course, was miserable, and then got over it. The food poisoning was gone, but she ended up having pretty much constant functional abdominal pain.
Mm,
How did that happen? Well, what happened is that episode, that one episode, left such an impression on her brain that there was a part of her brain that from that point on was
wow.
constantly scanning for danger. We call that hypervigilance.
Is it that almost similar to the PTSD of the gut that you were mentioning?
Yes,
Yeah.
exactly,
Wow. Yeah.
exactly. And
Mhm.
so it was constantly scanning, and then if it ever found anything that seemed
Wow.
even a little off, there was this catastrophizing that would occur. Her brain would be like, "Oh my god, what's gonna happen? Are we gonna be throwing up again? We can't let," like, and this all happened super fast. She was probably barely consciously aware of it, but all that stress and fear went down into the gut and caused it to react in such a way that it was clenching and freaking out, and then the visceral hypersensitivity was amplifying and distorting those sensations. So you can see, if we had a diagram right in front of us, we could loop out exactly how that feedback loop just keeps going over and over again.
Wow, that is a great example of what you had already alluded to at the beginning. I think that's so important. And, in that situation, or maybe in other situations, we already talked about the importance of the parent's reaction to random falls,
Yes.
right? But I would love to elaborate further on how a parent's response in maybe with a teenager or a younger child, whether
Yeah.
it's anxious, dismissive, or overly
Yeah.
reassuring, how can that affect the situation? And what would be your recommendation to responding to a child who's going through something like a functional abdominal pain or abdominal pain in general, knowing the gut brain axis is so active?
I'm glad that you flipped it over to the other side of it too, which is dismissive.
Mhm.
So if you've got this dismissive reaction, I think the child ends up feeling angry, sad, alone,
Yeah.
right? Kind of like, oh my God, nobody's here for me. And sometimes some kids will react angrily to that, and some kids will react like kind of sad and hopeless. But that's not also, obviously, that's not what we want either.
Yeah.
But then on the other side of it, we've got the parent who's maybe just as scared or more scared than the kid, and they're reacting with anxiety and treating them overly empathetically. And what that does is it reinforces in them that there's something very wrong with them and that they're not capable.
Yeah.
So what's that middle ground? That middle ground is that love with kind of, I'd say, expectations and boundaries. And
Yeah.
so what I say to a lot of my patients and the parents is, if you get a stomach ache here and there, you know, stay home, right? Stay home. It'll probably feel better. And if it keeps going, go to your doctor. But for the most part, you can miss school.
Yeah.
Um, but for patients that have these kind of chronic conditions, it just can't work. It just can't work. And so they have to learn to do something that's difficult, which
Yeah.
is, hey, I know this feels bad. This is uncomfortable. And we need to go to school.
I love the and not the but. I like
Yes.
that. Very
Yes,
strategic. Yes.
precisely. And that
Both are
language is
true. Yeah.
very precise. It's like,
Mhm.
we're not dismissing you with a
Yeah.
but we're saying, and it's tough, and we still need to go to school, and we still need to, do our homework or whatever those things are. Because if we start giving in, then the world starts constricting.
Yeah.
And I see a lot of these kiddos when, they've been they've been kind of homebound for a few months, sometimes years. And they develop all these secondary problems, right? And it gets even harder this is a bad analogy, but it's like a tick that's kind of burrowed really in deep.
Yeah.
It's hard to get them out because they develop all these secondary anxiety issues around school and around other kids, because now they're not getting enough socialization. And so we need to have those expectations that are paired with, empathy and love.
And of course, the next question is going to be multi-layered because it's not something we can fix overnight. But are there just certain behavioral therapies or psychological strategies that can help for these gut brain issues, whether it's obviously with a licensed psychologist or things that a
Yeah.
family can do that you feel like on a surface level is something that is important in addition to something like therapy, which I would all my patients that I'm concerned about that functional abdominal pain is the diagnosis. I recommend all of them to see a psychologist, but the negative is that not all psychologists
Right.
are like you that understand the sensitivity of the gut brain connection, which is wild.
So
Yeah.
here's the plus and the minus.
Yeah.
Sending them to a therapist or a psychologist, it's not going to be bad, and it can be good,
Yeah.
right? They're going to help with anxiety. They're going to help with stress. They're going to build coping skills. The problem is that there are specific forms of therapy that have been shown to be effective. CBT in general has not been shown to be
Mm.
effective for something like functional abdominal pain. However, there are specific protocols within CBT that have been shown to be effective that very few therapists are trained to do. Um, and so that's a big problem, because a lot of my patients will come to me and I'll start talking about CBT, and they'll say, "Oh, no, 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 we did that already. We did CBT." And I have to say, "Well, did you do it like this?"
Yeah.
And the answer is usually no, because they were referred to a general practitioner. The
Yeah.
other side of it is that clinical hypnosis is an amazing tool for these kinds of problems, that a lot of people think they know a lot about. And what they know a lot about is entertainment hypnosis.
Mm. Yes, like when you go to the show and they're like, yeah,
Go to
they're
the
like, "I
show.
can't fall for that." Right, this is not the same type of yeah.
Right. This is
Hypnosis.
clinical
Yes,
hypnosis, which literally at this point has 40 years, over 100 of studies done showing how well it works. Like 80% of patients will reach their treatment goals based on the research. And kids respond even better than adults do.
amazing. And to find someone who does that, it would be a psychologist, obviously, who is trained in clinical hypnosis. It's not something that all psychologists are, able to do.
Yeah, sadly, it's even
Mhm.
more specific. It's
Mm.
it's some kind of therapist that's trained in clinical hypnosis, that's specifically trained in clinical hypnosis for GI problems,
Okay. But
right?
I mean, obviously your platform is
Yeah,
obviously like is trying to get even more of that availability via telehealth, correct?
exactly.
Yeah.
It's gipsychology.com. That's our website, but right now we've got, I think, 14 therapists that are all fully trained up, and we're hiring more. Um, and they're all trained in these very specific modalities of therapy and techniques. That's the whole idea.
I think this is so fascinating. I knew it was fascinating before because that's why I wanted you on the show. But just hearing your terminology, obviously how how the body responds to stress is pain. Like there's so much in here that was
Yeah.
just so valuable. What would be your final uplifting message for everyone tuning in, which are mainly parents of children, maybe who have this issue, or maybe down the line will have this issue?
Yeah, I think one important thing to know is that they don't need to live with it.
Mm-hmm.
I think there are some, not you, Dr. Mona, but there are some doctors out
There
there
are.
that
Mm-hmm.
will do all the tests, rule out all the things, and then they'll say, "Okay, you just got to live with it,
Yeah.
try to relax more, like whatever." Like I don't
You're
I've heard
right.
some
It's
terrible things.
I have too. I have seen those colleagues of mine and I'm like, "Whoa." I'm like, "Come
Yeah.
on. Like this is a real thing and we can help them whether it's us or someone who's like yourself or, there are
Yeah.
solutions." Right.
Yeah, and so they're left with the impression that their answers aren't in the traditional medical space, and so they either accept that they need to live with it, or they start kind of wandering the wilds of the internet,
Yeah.
right? And they end up in supplement town, or
Yeah.
other kind of stranger places looking for help. And I've heard it all over the years, but they end up in places where there isn't very much, if any, actual research
Right.
showing it can be helpful. So that your kid doesn't have to live with it, and that there are very well studied, effective modes of treatment for them, um, that are available.
This was such an incredible conversation. Thank you so much. I know, say the website again where people can get more information about obviously what you're trying to build and what you've already built and, how they can stay connected with you as well.
Yeah, so there's the website is gipsychology.com,
Mhm.
and we offer a free 15-minute phone call with a trained clinician. Like, this is someone who already is clinically trained. They can answer all their questions about how this stuff works to see if it would be right for them. Um, yeah, and I just don't want people to have to have these kids be in pain longer than they need to be.
I
You know.
appreciate that because I think that is a mutual goal here. And in anything we deal with, especially, I'm a parenting podcast, parenting account. I don't just talk about abdominal pain, but it is such an important area that I think, like you said multiple times, that many children get dismissed, get told that, okay, well, we have nothing on labs, so everything is good.
Right.
That doesn't mean that there isn't a reason or that there's nothing that we can do. It's having those conversations so that we're not just living with it. We can actually maybe get better. And I'm a big believer of that, and I'm happy you embody that as well. So thank you so much for coming on the show today.
Dr. Mona, it was a pleasure. I didn't realize who I was going to be talking to,
I
how
right.
into this. Yeah, yeah, I loved it. This was so fun.
Well, thank you. And for everyone tuning in, as you can see, I don't always know the guests that are coming on. And obviously, we kind of hash out what we're going to talk about. But I just loved what I heard. I hope you loved what you heard. And if you did, you need to make sure you subscribe to this channel. Make sure you give this video a thumbs up, share it on social media. Whether your child has functional abdominal pain, whether someone in your community does, or maybe you've been dealing with something in the medical system where you just hadn't felt seen and you just want people to hear how we talk about pain, even though we are talking about abdominal pain. I just think this is such an important conversation. And I will be linking all of the information for this practice as well as Dr. Navidi's contact information so that you have that for his practice as well. So thank you, and we'll catch up with you all next time.